What is snoring? What are the ill effects of snoring? How is your personal life affected? How is your public life affected? Snoring is a common condition that can affect anyone, although it occurs more frequently in men and people who are overweight. Snoring has a tendency to worsen with age. Occasional snoring is usually not very serious and is mostly a nuisance for your bed partner. However, if you are a habitual snorer, you not only disrupt the sleep patterns of those close to you, but you also impair your own sleep quality. Medical assistance is often needed for habitual snorers, and their loved ones, to get a good night's sleep. How does it occur? Snoring occurs when the flow of air through the mouth and nose is physically obstructed. What are the causes of snoring? Airflow can be obstructed by a combination of factors, such as obstructed nasal airways. Some people snore only during allergy seasons or when they have a sinus infection. Deformities of the nose such as a deviated septum. Nasal polyps can also cause obstruction. Poor muscle tone in the throat and tongue. Throat and tongue muscles can be too relaxed, which allows them to collapse and fall back into the airway. This can result from deep sleep, alcohol consumption before bedtime, or use of some sleeping pills. Normal aging causes further relaxation of these muscles. Bulky throat tissue. Being overweight can cause bulky throat tissue. Also, children with large tonsils and adenoids often snore. Long soft palate and/or uvula. A long soft palate or a long uvula, the dangling tissue in back of the mouth, can narrow the opening from the nose to the throat. When these structures vibrate and bump against one another, the airway becomes obstructed, causing snoring. Health risks associated with snoring. Habitual snorers can be at risk for serious health problems, including obstructive sleep apnea. Sleep apnea creates several problems, such as interruptions of breathing, lasting from a few seconds to minutes, during sleep caused by partial or total obstruction or blockage of the airway. Frequent waking from sleep, even though you may not realize it. Poor night's sleep leads to drowsiness during the day and can interfere with your quality of life and increase risk for car accidents. Strain on the heart. Prolonged suffering from obstructive sleep apnea often results in higher blood pressure and may cause enlargement of the heart, with higher risks of heart attack and stroke. Tips to prevent snoring. Rather than lying flat on your back, add few extra pillows and prop yourself up in bed. You'll prevent the tissues in your throat from falling into your air passages. Elevate the head of your bed. Sleep on your side. The biggest challenge will be how to maintain the position. Using a body pillow could be useful. Try using nasal strips, available at most drugstores. Following the directions on the package, tape one of the strips to the outside of your nose before you fall asleep. They'll lift and open your nostrils to increase airflow. Reduce bedroom allergens, dust, pet dander, mold, to alleviate nasal stuffiness by vacuuming floors and drapes regularly. Change sheets and pillow covers often. Don't eat a heavy meal or drink alcoholic beverages within 3 hours of turning in. Both can cause your throat muscles to relax more than normal. Avoid dairy products and big meals late at night. Losing some weight may help in improving your snoring. Quit smoking. Tobacco smoke irritates mucous membranes, so your throat swells, narrowing the airway. Smokers also have more problems with nasal congestion. If you're regularly taking any kind of medication, talk to your doctor about alternatives. Some drugs can make snoring worse, including sleeping pills and sedatives. Home remedies to combat snoring. Peppermint. The anti-inflammatory property in peppermint helps reduce swelling of the membranes in the lining of the throat and nostrils, thus promoting easy and smooth breathing. This works well for temporary snoring due to an allergy, a cold or dry air. Add 1 or 2 drops of peppermint oil to a glass of water. Gargle with it before going to bed. Make sure not to swallow this solution. Do this daily until you get the desired result. If dry air and congestion are causing your snoring, add a few drops of peppermint oil. You can also use eucalyptus oil, to a humidifier about 30 minutes before you go to bed and turn it on. Run the humidifier overnight. This will help open up your airways so you don't snore. You can also rub a little peppermint oil into the lower portions of each side of your nose before going to bed. Take few leaves of peppermint, or mint leaves, wash them and boil them in a glass of water. Strain the water and add 2 teaspoons of honey. Drink this every night before going to bed. Olive oil. Being a strong anti-inflammatory agent, olive oil eases the tissues all along the respiratory passages, reducing the swelling to provide a clear passage for air. It can also reduce soreness. Use this remedy regularly to also lessen the vibrations in the throat and stop snoring. Take 2 or 3 sips of olive oil before going to bed daily. Combine 1/2 teaspoon each of olive oil and honey. Consume it daily before going to bed. Clarified butter. Clarified butter, also known as ghee, has certain medicinal properties that can help open up blocked nasal passages. This in turn will help you snore less and sleep better. Slightly warm a small amount of clarified butter in a microwave. Use a dropper to put 2 or 3 drops of lukewarm clarified butter in each nostril. Do this daily before going to bed and again after waking up the next morning. Cardamom. Cardamom is an expectorant and decongestant, making it effective for opening up blocked nasal passages. Free air passage will result in less snoring. Add 1/2 teaspoon of cardamom powder to a glass of warm water. Drink it 30 minutes before going to bed. Do this daily to gradually reduce your snoring. Turmeric. This works as an antiseptic and antibiotic agent. Turmeric can treat inflammation and help reduce heavy snoring. Add 2 teaspoons of turmeric powder to a glass of warm milk. Drink it 30 minutes before going to sleep. This will help you breathe freely while you sleep and also boost your immune system. Do this every day. Long pepper or Indian long pepper. Take 1/2 teaspoon of olive oil, some long pepper powder and honey. All these 3 should add up to 1 teaspoon. Mix these well and have it every night before bed for good relief from snoring. Garlic. Garlic is quite effective against the mucus buildup in the nasal passage. It also works quite effectively in the respiratory system. So, if your snoring is caused by the sinus blockage or any related issue, then garlic will be quite helpful to you. You can directly chew garlic cloves and then use a glass of water to flow it down your throat. Use this remedy daily before bedtime for a reduction in snoring and to induce sound sleep. You can also put some garlic while cooking your meal and eat them while they are hot. Chamomile. Chamomile is quite known for its anti-inflammatory effects that can help in reduction of snoring. It also acts as muscle and nerve relaxant that can help in easing muscle tension around the throat and help in sound sleep. Add about 1 tablespoonful of chamomile flower or a chamomile tea bag in a cup of water. Boil the same for about 15 minutes. Strain the mixture and add about a tablespoonful of honey. Stir it well and consume the warm tea before going to bed. Drinking this tea will help in reducing inflammation and helps in the better snoring-free sleep. Nettle. If your snoring is limited to a particular time of the year, then it is probably because some kind of seasonal allergy which is causing blockage in your nasal cavity. These kinds of snoring can be treated effectively with nettle due to its antihistamine and anti-inflammatory properties. Add about a tablespoonful of dried nettle leaves in a cup of boiling water. Allow it to steep for 5 minutes and then strain the solution. Drink it warm before going to bed. Consuming about 3 cups of nettle tea daily can help in getting relief from snoring. Spearmint and fenugreek. Fenugreek and spearmint are amazing herbs that can cure snoring from digestive issues, in particular caused by indigestion. These herbs can help rid your body of this acid and decrease your chances of snoring while you sleep. Fenugreek has been shown to fight sleep apnea and improve digestive issues that lead to snoring, while spearmint also relieves indigestion and acid reflux symptoms that can also contribute to snoring. Honey. Another home remedy for snorers is honey. Due to its unique anti-inflammatory properties, honey can help in reducing the swelling around the throat area that are causing obstruction in the air passage. Other than that, it also helps in lubricating the throat, also helps in reduction of snoring vibrations. Take about 1 tablespoonful of honey in a glass of warm water and drink it before going to bed. Follow this remedy daily for better effect. Other than aforesaid method, you can also use honey along with herbal tea after dinner. Vitamin C. Vitamin C may help prevent sinuses and it helps promote a healthy immune system, so that there is no obstruction in the airway while sleeping, due to sinuses. Eucalyptus and peppermint steam inhaling. Eucalyptus oil will provide a snore-free night of sleep. Putting eucalyptus leaves in a steam inhaler and breathing it through your mouth or nose can help clear your sinuses. You can also add 5 drops of eucalyptus and 5 drops peppermint essential oils to the steam inhaler. Doing this just before bed will help clear out your airways and reduce inflammation in your nasal passages that may be a contribute to the snoring problem. Regular throat and tongue exercises. A stronger throat and tongue may help avoid over-relaxation of the throat area. Try putting your upper and lower molars gently together. Open your mouth, focusing on pressing your molars wide apart but not to the point of overstretching. Repeat this 10 to 15 times, and you will start to feel the back of your mouth opening up. Practice yoga. You can also practice yoga under the guidance of registered yoga master. Yoga teaches you effective and easy breathing patterns that can ease your snoring and enables you and your sleeping partner a relaxed sleep. Types of snorers. Mouth shut snorer. If your mouth stays shut while you snore, it may indicate a problem with your tongue and nasal passageways. Mouth wide open snorer. If you snore with your mouth wide open, this could be an indication that the tissues in your throat are more likely to be causing you to snore. If your throat is partially obstructed, you're apt to try to force in more air, which creates the snore sounds. Back snorer. Sleeping on your back often causes you to breathe through your mouth. This can making snoring worse. A snorer no matter what. If you snore in any position no matter what, it could be a sign of a more serious problem, such as sleep apnea. Please have a visit with your doctor if your snoring is loud enough to keep your partner awake, you wake yourself up, everything you have tried does not seem to help, or you snore in any sleeping position. You may need a more specified approach or more individualized details from a healthcare provider to determine how to stop snoring in this case.